So when the pandemic began, we immediately commenced what's known as our incident management response. And that's something that's hugely unfamiliar in terms of how we would ordinarily run the organisation. There was a recognition that we were walking into something that we'd never ever faced before. And then in the midst of all that, we tragically lost 3 members of staff to COVID-19. And it was probably the most profound moment of the 30 odd years I've been in the NHS. And we know that COVID-19 affects certain vulnerable groups, and one of which, where there's new emerging evidence, is our BME colleagues. So there was a real challenge about offering assurance, reassurance, recognising people's fears and anxieties.
We invested in training, especially around the use of personal protective equipment and adherence to infection control precautions. We will continue to have those courageous conversations. We will continue to have the necessary debates and hopefully get to a point where we feel we are assured as an organisation and as a group that we've done the best we can.
The one thing that if you switched on a news channel, all you saw was the massive shortages around PPE. It was pretty dire. It wasn't just a problem for us, it was a national problem. And we needed to put in place a structured group and really brought some structure to how we organised. Within a week, that enabled us to build up that stock so that people could work safely.
There was a need to redeploy some of our amazing staff across the organisation and ask them to do different things, to work in a different way or in different teams.
In the very early stages, there was a lot of uncertainty for staff, and that caused obviously a lot of anxiety. And we really tried hard to keep the communication channels open and to make sure that where people felt that they didn't have the skills that they needed, that they got the right training.
Foremost has to be you have to be clinically confident in what you're doing. So obviously training is a big element of that, and that a lot of my previous roles have been around clinical skills training. So that was, for me, trying to be that mode of support for staff to be trained competently in that type of skill.
I am a school nurse. For the last few weeks I have been redeployed to Brentwood Community Hospital, which is very, very different to what I usually do. The staff have been very, very, very accommodating. I feel like I'm home, and I feel like I'm part of the team.
There's been a lot of talk nationally about what's called wobble rooms, which are kind of a safe space to staff to go to kind of burn off steam or relax or get a little bit of support. We managed to source a space on site, and we also got some redeployed staff to help develop the wobble rooms. And then since then we've developed a further 6 spaces across the trust.
I've always felt that I've been supported within Nelft. We are having really supportive meetings, and I think the quality of care that we're giving to the patients definitely has improved. And yes, it's amazing what we've achieved. The support has been great as well.
We started off here in Brentwood with 20 beds. We've provided 20 beds here for some time. As we stand here today, we now have 159 beds, and we managed to create this site in just a matter of weeks. And fundamentally, that was about having volunteers. We had the fire brigade here at weekends, we had the ambulance service, we've had the army here. So everybody has come together in this community.
This is the first experience I've had as a doctor where patients' families aren't able particularly to come in and see their relatives on a daily basis. Knowing that you are that medium between the patient and their relative, and they can't come and see their loved one, especially at times of that patient reaching the point of passing away. That's definitely been where my practice has had to be challenged, and I felt that myself, the nurses, other doctors, our consultants have all pitched in and been able to rise above that.
I'm really, really proud of the team. I'm enormously proud of the staff, of all the clinical staff. But essentially this is what we are trying to do.
I'm so proud to be part of Nelft. I'm so proud to be part of the organisation that have been able to meet the challenges. And I think this particular event will live with me and will be told to my children, my grandchildren and their forth as to what we did and how the NHS rose up to the challenge.
One of the challenges we face with this pandemic is we don't know when it will end. What we know now is this first surge is reducing, but it's likely we'll see further surges. And in some ways that means that we've got to remain really agile. If the peak comes again, we've got to rapidly scale up our services to meet the needs of the public. What I'd really like to say to all my colleagues in health is just a huge thank you. You are just simply amazing, and what you've done over the past few weeks is incredible, and I am so enormously proud to walk alongside you. You're just terrific.
Since I've been in here, it has been really good. They've really boosted my morale. They've helped me a lot with my physio, and they've made me want to go home. They are absolutely wonderful, all of them. They all work their socks off, and they are really lovely to me, and I know to all the other patients. I'd like to say well done, they're all stars, all of them.